Welcome to This Week in Neurology. This week we are covering 10 notable papers spanning 3 major clinical areas: advanced biomarker staging in neurodegenerative diseases, clinical innovations in acute stroke management, and emerging paradigms in neuroimmunology and neuroinfectious diseases. Let's dive in. We begin this week with a deep dive into neurodegenerative diseases, where new diagnostic tools and staging frameworks are transforming how we characterize cognitive decline in clinical practice. In the journal Brain, a large-scale study of 1,008 consecutive Han Chinese individuals with cognitive impairment evaluated the real-world utility of tau positron emission tomography compared to amyloid positron emission tomography. The investigators recruited patients between March 2020 and July 2025, performing comprehensive clinical assessments alongside both imaging modalities. For diagnosing Alzheimer's disease, tau positron emission tomography demonstrated outstanding sensitivity at 97.8% and a specificity of 95.4%, showing substantial agreement with amyloid imaging. Crucially, tau imaging provided significant incremental value, leading to a diagnostic change in 10% of patients, even after an amyloid-positive scan had already been performed. In patients clinically diagnosed with non-Alzheimer's disorders, tau positron emission tomography led to a significantly higher rate of diagnostic change compared with amyloid imaging alone. This diagnostic clarity translated directly to clinician confidence, which rose from an average of 68.6% to 84.2% when tau imaging was integrated. This pragmatic clinical utility is further supported by another study, which evaluated the newly revised 2024 biological and clinical staging criteria for Alzheimer's disease in a cohort of 1,214 memory clinic patients in China. Among the 818 amyloid-positive individuals, the researchers discovered that clinical biological discordance is remarkably common, affecting nearly half of all patients. They classified patients into 3 distinct phenotypes: typical, representing about 50%, susceptible, representing 40%, and resilient, representing about 9%. Resilient individuals, who had milder clinical symptoms than their biomarker burden would suggest, possessed higher educational attainment, superior cognitive performance, and greater cortical thickness and volume in Alzheimer's signature regions. Conversely, susceptible individuals showed worse cognitive scores, reduced cortical thickness, and a higher burden of vascular risk factors. Furthermore, the study demonstrated that plasma phosphorylated tau 217 levels increased in a clear, stepwise fashion across advancing tau positron emission tomography stages, rising from 0.56 picograms per milliliter in stage A to 1.31 picograms per milliliter in stage D, reinforcing its role as a highly reliable blood-based marker of pathology severity that can easily be integrated into clinical workflows. While biomarker staging helps us track the physical progression of neurodegeneration, we must also remain highly vigilant regarding the neuropsychiatric manifestations of these diseases, particularly in their prodromal stages. Writing in Neurology, researchers from the North American Prodromal Synucleinopathy Consortium investigated the frequency of suicidal ideation in 489 patients with isolated REM sleep behavior disorder, which is a well-established prodrome of alpha-synucleinopathies like Parkinson's disease and dementia with Lewy bodies. They found that recent suicidal ideation is alarmingly common, affecting approximately 1 in 12 patients or 40 individuals in this cohort. Patients who endorsed suicidal ideation on the Patient Health Questionnaire 9 experienced significantly greater autonomic dysfunction on the Scale for Outcomes in Parkinson's Disease Autonomic Questionnaire, worse motor symptoms on the Unified Parkinson's Disease Rating Scale Parts 2 and 3, and more pronounced cognitive deficits on the Montreal Cognitive Assessment. This suggests a specific, high-risk clinical phenotype of isolated REM sleep behavior disorder that demands proactive psychiatric screening and targeted interventions to prevent self-harm. Moving to acute stroke care, several new studies are challenging traditional treatment boundaries and refining how we stratify post-stroke risk. First, a major pediatric cohort study published in Neurology addresses a critical clinical dilemma: whether to perform endovascular thrombectomy in children with large vessel occlusion stroke who present with only mild symptoms. Pooling data from 4 major international registries across Europe, North America, and Australia, researchers analyzed 63 pediatric patients with a baseline pediatric National Institutes of Health stroke scale score of 5 or less. Children who underwent endovascular thrombectomy had 5.5 times the odds of achieving superior functional outcomes at 3 months compared to those managed medically. Additionally, over a third of the medically managed children experienced early neurological deterioration within the first 24 hours, compared to only 4% of those in the thrombectomy group, with no symptomatic intracerebral hemorrhages reported in either group. This provides strong Class 3 evidence supporting early intervention to prevent devastating secondary decline in children. For adult patients with minor ischemic strokes and proven occlusions, a secondary analysis of the TEMPO-2 trial published in the journal Stroke examined the relationship between successful recanalization and long-term recovery. Among 517 patients with follow-up computed tomography angiography, successful recanalization was associated with a 21% relative increase in the likelihood of returning to baseline functional status at 90 days. It also dramatically reduced the rate of early stroke progression from 13.1% down to just 2.8%. Notably, treatment with tenecteplase was identified as the strongest independent predictor of achieving successful recanalization, more than tripling the odds of success compared to standard medical care, emphasizing the value of early thrombolysis even in minor presentations. Once the acute event is managed, long-term secondary prevention must be tailored to the patient's specific underlying pathophysiology. A nationwide cohort study of over 21,000 patients in Japan investigated long-term outcomes after ischemic stroke across 3 distinct atrial fibrillation phenotypes. These included patients who suffered a stroke despite already taking oral anticoagulants, those who were anticoagulant naive, and those whose atrial fibrillation was first detected after the stroke. The researchers found that these phenotypes represent highly heterogeneous risk groups. The 5-year cumulative incidence of recurrent stroke or systemic embolism was highest in the group already on anticoagulants, reaching 18.6%, and lowest in the group whose atrial fibrillation was detected after the stroke, at 10.5%. Patients with stroke despite prior anticoagulation also experienced a significantly higher risk of heart failure hospitalizations, highlighting the urgent need to treat these phenotypes as distinct target populations in secondary prevention trials rather than a single homogeneous group. In the field of neuroimmunology and neuroinfectious diseases, researchers are gaining a deeper understanding of long-term prognosis and the complex viral triggers of autoimmune pathology. A critical international multi-center study published in Brain characterized the 3-year prognosis of 245 patients who survived progressive multifocal leukoencephalopathy for at least 1 year. While nearly 46% of these long-term survivors achieved functional independence at 3 years, the vast majority, about 85%, were left with permanent neurological sequelae, most commonly motor or cognitive impairments. Patients with HIV-associated progressive multifocal leukoencephalopathy had more than double the odds of a favorable functional outcome compared to other causes of immunosuppression, whereas a higher baseline clinical disability and a greater number of affected brain regions on magnetic resonance imaging were strong predictors of poorer long-term outcomes. Alarmingly, disease recurrence occurred in nearly 3% of patients and was almost always fatal, emphasizing that vigilance must continue long after the acute phase. The search for upstream triggers of neuroimmunological disease remains a highly active area of research, particularly regarding multiple sclerosis. A comprehensive review in The Lancet Neurology synthesizes the overwhelming epidemiological and biological evidence linking Epstein-Barr virus to multiple sclerosis pathogenesis. The authors highlight how Epstein-Barr virus interacts with multiple genetic susceptibility loci to alter B-cell transcriptional programs, leading to the expansion of neuroinvasive atypical B cells. These cells infiltrate the central nervous system, where they drive localized inflammation and stimulate autoreactive T cells. This mechanistic framework is now fueling exciting therapeutic strategies, including Epstein-Barr virus-specific vaccines, allogeneic cytotoxic T lymphocyte therapies, and chimeric antigen receptor T-cell therapies targeting these specific B-cell subsets. Meanwhile, the underlying etiology of other suspected autoimmune disorders is being actively debated. A perspective piece in Nature Reviews Neurology critically examines the pathogenesis of narcolepsy type 1, which is characterized by a loss of hypocretin-producing hypothalamic neurons. While the disease's strong association with the HLA-DQB10602 allele has long led to the assumption that it is a classic autoimmune disease, the authors discuss an emerging alternative model. This model suggests that immune-triggered epigenetic silencing of the hypocretin gene, rather than direct autoimmune destruction of the neurons themselves, may drive the disease. Reconciling these models is critical, as an epigenetic mechanism opens up entirely new therapeutic avenues aimed at reversing gene silencing rather than simply halting immune-mediated cell death. Finally, when acute neuroimmunological or structural insults culminate in refractory status epilepticus, our clinical frameworks must adapt. Writing in Epilepsia, researchers propose a new concept termed Stage 1+ to guide rational polytherapy in status epilepticus. This framework moves away from the traditional, rigid sequential treatment guidelines which recommend a benzodiazepine followed by a single second-line agent. Instead, Stage 1+ identifies patients at high risk of early benzodiazepine failure based on specific clinical phenotypes, such as prolonged seizure duration, non-convulsive status epilepticus with coma, or acute symptomatic status epilepticus from an active central nervous system lesion. By recognizing these high-risk phenotypes early, clinicians can initiate biologically grounded polytherapy immediately, bypassing the delays of sequential therapy and potentially preventing the development of highly drug-resistant status epilepticus. If you only have time for one paper this week, make it the Pediatric Large Vessel Occlusion Study. This landmark registry analysis provides the first high-quality, multi-center evidence that endovascular thrombectomy is highly beneficial for children presenting with mild stroke symptoms, offering a vital decision-making tool to prevent early neurological deterioration in this vulnerable population. Here are the key takeaways from this week in neurology. First, tau positron emission tomography imaging provides substantial diagnostic value beyond amyloid imaging alone, particularly in non-Alzheimer's tauopathies, and significantly boosts clinician diagnostic confidence in memory clinic settings. Second, under the revised 2024 Alzheimer's criteria, clinical biological discordance is highly common, and plasma phosphorylated tau 217 serves as a reliable marker that correlates tightly with advancing tau positron emission tomography stages. Third, endovascular thrombectomy should be strongly considered for pediatric patients with large vessel occlusion stroke, even when presenting with mild symptoms, as it significantly improves 3-month functional outcomes and prevents early neurological deterioration. Fourth, patients who experience an ischemic stroke despite already taking oral anticoagulants represent a distinct, exceptionally high-risk phenotype, with elevated rates of recurrence and heart failure, requiring aggressive secondary prevention strategies. And fifth, while nearly half of progressive multifocal leukoencephalopathy survivors achieve functional independence by 3 years, the vast majority carry permanent neurological deficits, and any late disease recurrence carries an extremely high mortality rate. That's your roundup for this week in neurology. The full transcript and references are available on the episode page in your Audio Scholar library. This is an AI-curated summary. For clinical decisions, always consult primary sources and current guidelines. See you next week. If this weekly briefing is useful, follow the show in your podcast app so new episodes arrive automatically. And for audio briefings on your own clinical questions and papers, visit audioscholar.cc. This is an automated summary generated by artificial intelligence, which can make mistakes. Always review the original source materials.